Welcome to Vitality Digest. Today, we open a gentle conversation about a common topic that is often left unsaid: ejaculating daily. No judgment, no extremes. Just neat, concise information to help you understand your body better and choose a pace that fits your current life. You will hear about the commonly mentioned positive points, the easily overlooked risks, a reference benchmark based on East Asian culture used as a starting line, not a strict rule, and a simple self-monitoring method to make decisions based on your own real experience. This content is for reference only. For personal concerns, seek advice from an appropriate professional. 1. There is no single standard number for everyone. The right frequency is the frequency that leaves you feeling good regarding your energy, mood, sleep, and quality of experience, not some number hanging on a wall. For some people, a daily rhythm brings a sense of relaxation, deeper sleep, and greater confidence. For others, the same. Rhythm leads to feeling heavy, a dip in desire, or reduced sensitivity. Differences stem from age, endocrine, cardiovascular status, stress levels, the type of stimulation: fast, slow, monotonous, varied, sleep quality, nutrition, alcohol, substance use, and exercise. If you are trying to conceive, many couples find a rhythm spaced about 48 to 72 hours apart more effective during the fertile window. Therefore, any rule should only be seen as a starting point for experimentation, not a benchmark to achieve. The practical approach is to briefly log 5 factors: energy, mood, desire, quality of experience, and sleep. Apply 2 different rhythms for 2 weeks, then compare your feelings. Consistent data from yourself is more trustworthy than hearsay and will show you which rhythm suits your current life situation. 2. The commonly mentioned positive aspects. Many people describe feeling relaxed, clear-headed, and falling asleep easier after climax. A sense of body control can boost confidence when the frequency is maintained at a level the body accepts well. Physiologically, the excitement climax phase involves a temporary increase in heart rate and blood flow. Some compare it to a mini physiological reset that helps the body respond flexibly. Some observational summaries note a link between regular activity and certain favorable health indicators, though correlation does not prove causation and does not replace routine checkups. Your actual experience is key. After each instance, write a very short note. Did sleep feel deeper that night? Were you alert the next morning? Was your mood even? Did work flow smoothly? As your log accumulates, you will clearly see the pattern. Which rhythm helps your mind settle, your body stay healthy, and your general life run smoother? That is a signal worth following to maintain or adjust your pace. Number 3, risks: compulsive behavior and dependence on pleasure. Sometimes a habit starts with a very mild intention, just to relieve tension, but over time, it can start controlling you, delaying important tasks, causing difficulty concentrating, avoiding genuine connection, or masking emotions. When you cling to pleasure as the only coping mechanism for stress, boredom, or loneliness, other healthy outlets, getting enough sleep, exercise, meditation, journaling, talking to loved ones, or a professional are easily neglected. This cycle can lead to guilt, self-blame, and a new layer of stress. Set a safety frame. Limit the duration, go slow, pay attention to your breath and full body sensations. Prioritize the quality of the experience over counting the times. Simultaneously, incorporate at least 2 non-sexual stress relief habits like brisk walking, full body weight training, or a few minutes of slow breathing daily. If you notice impulses starting to dominate, ease the frequency, add rest days, diversify pleasant activities, and seek professional support when needed. The goal is to maintain a healthy relationship with pleasure, letting it enrich your life rather than leading it. 4. When the goal is conception, a different frequency strategy. When there are no plans for children, the daily rhythm is mainly a matter of preference and sensation. However, if you are trying to conceive, the frequency strategy should revolve around your partner's fertile window and your body's recovery capacity. Many couples opt for a rhythm spaced about 48 to 72 hours apart during the fertile window to balance frequency with semen quality. Too frequent, a rhythm can create performance pressure, leading to anxiety and a poorer experience. Shift the focus from hitting a number to right timing, good experience. Prioritize good sleep hygiene, relaxation, and connected intimacy rather than rushing. Lifestyle foundations: 7 to 8 hours of sleep, a balanced diet, a mix of strength and cardiovascular exercise. Limited alcohol smoking directly impacts semen quality and overall well-being. Any unusual signs like pain during ejaculation, blood in the semen, or sudden changes in volume or odor need to be checked out. Optimizing conception is a story of patience, rhythm, and comprehensive care. 5. Sensitivity, desire, and the speed habit. The body learns what you repeat. If a high frequency is paired with fast and monotonous stimulation, the nervous system can easily learn a shortcut to the finish line, shortening the phases of sensation, connection, and breath regulation. Over time, some people report decreased sensitivity, reduced desire, increased performance anxiety, or a tendency toward finishing too quickly in real-life situations. Gentle adjustments include deliberately slowing down, focusing on each breath, pausing when arousal increases too fast, returning to full body awareness, using edging to prolong the arousal phase without immediate climax, varying stimulation so the brain isn't locked into one script. After 1 to 2 weeks, if sensitivity remains low, ease the frequency by 24 to 72 hours while reinforcing sleep, nutrition, strength, cardio training, and limiting alcohol smoking. The goal is to restore natural sensitivity and excitement, prioritizing the quality of experience over the count. 6. Age benchmark, the 9 formula. There is a memorable folk benchmark in East Asian culture, often called the 9 formula. The interpretation is very simple. Take the tens digit of your age, multiply it by 9, resulting in a 2-digit number. The first digit is understood as the number of weeks, and the second digit is the suggested number of times within that period. 2 times 9 equals 18, interpreted as 1 week, 8 times, about 1 to 2 times per day. 30s. 3 times 9 equals 27, interpreted as 2 weeks, 7 times approximately 3 to 4 times per week. 40s. 4 times 9 equals 36, interpreted as 3 weeks, 6 times, about 2 times per week. As you age, the suggested pace slows down to match stamina. Crucially, understand this is not a medical standard, only a starting line to help reduce confusion initially. Try the suggested level, then listen to your body. Is sleep deep? Is next day energy fine? Is your mood even? Does desire come naturally? If you feel pressure or prolonged fatigue, slow down. If things feel good, you can maintain it. The goal is always a sustainable rhythm, a light body, and a calm mind. 7. Modern medical viewpoint. No universal quota. In modern medical literature, there is no standard number that applies to everyone. Frequency should be personalized based on sleep, stress levels, underlying health, lifestyle habits, and current goals. Some observational studies note links between regular activity and certain favorable health markers, but correlation is not a mandate, nor does it become a standard of so many times per week. Therefore, age benchmarks should only be seen as soft references to start with. Afterward, ask very practical questions. Did you sleep deeply last night? Is your mind clear this morning? Is work flowing? Are emotions stable? Is intimacy warm? When your life rhythm changes, a tight project, a lot of travel, heavy training, increased stress, the appropriate rhythm should also change. Flexible adjustment is the way to maintain long-term sustainability. The final reminder, your rhythm is the one that allows your body to recover well and your mind to feel at ease, not the one that forces you to chase a number. 8. Applying the age benchmark safely, without pressure. Start gently, allowing for slight variations to fit your lifestyle instead of forcing yourself to match the formula. When practicing, go slow to give your body time to feel. Focus on your breath, full body sensations. Avoid fast forwarding to the end. The full experience is often more valuable than counting the times. Vary stimulation so the brain doesn't get locked into one script, helping maintain sensitivity and novelty. Concurrently, maintain your health foundation, 7 to 8 hours of sleep, balanced eating, strength and cardiovascular exercise, limited alcohol, smoking, these factors directly affect desire, recovery capacity, and the quality of the experience. If you notice uncomfortable signs like prolonged fatigue, a clear drop in desire, pain, or discomfort, reduce the frequency or take a break to prioritize recovery. The goal is not the right formula, but a sustainable rhythm that helps you sleep well, think clearly, focus on work, and feel more natural in your intimate connections. 9. The 2-week test to find your fit. Perform a light test to let your body speak. The first week, follow the suggested rhythm based on your age, remaining flexible to avoid pressure. The second week, space things out. Let the instances be about 48 to 72 hours apart to observe the difference. Every evening, jot down a few short notes. How was energy today? Was mood? Even did desire come naturally or feel forced? Was the experience fulfilling? Did sleep feel sound? If there was any pain, discomfort, or psychological stress, note it down. After 2 weeks, look at the big picture, the rhythm that helps you sleep deeper, focus better, and maintain excitement. Prioritize that one. If the two rhythms seem similar, choose the option that places less pressure on your schedule. After 1 to 2 months, you can try again, as the body constantly changes with seasons, work, training, and stress levels. This is how you make decisions based on real experience, rather than being bound by a fixed number. 10. When to see a professional and final reminder. This content is for reference and helps you self-adjust. Seek medical support when you see red flags, pain during ejaculation, blood mixed in the semen, pain in the pelvic floor area, sudden changes in volume or odor, persistent erectile dysfunction, or psychological distress affecting work and relationships. If the goal is conception and you encounter obstacles, discuss it to get guidance on appropriate timing and frequency while reviewing underlying lifestyle factors. Reiterate gently, there is no single right number for everyone. The age benchmark is just a handrail to start. The right rhythm is the one that keeps your body healthy, your mind calm, and your relationships warm. Once you find that feeling, you don't need to cling to any formula. Just listen and fine-tune according to your life's rhythm today so each day passes more smoothly and fully. In conclusion, what matters is not a number, but how your body truly feels day to day. Treat the age benchmark as a starting point to feel less awkward initially. Then listen. Did you sleep deeply tonight? Are you alert upon waking? Are you focused at work? Is intimacy warm? If the answer is yes, you are close to your rhythm. If no, slow down, space out the frequency, and prioritize recovery. When your life schedule changes, more stress, heavier training, more travel, the appropriate rhythm should change too. That is normal. And if any red flags appear, such as pain, blood in the semen, prolonged discomfort, or psychological pressure, do not hesitate to seek professional help. Choose quality over counting. Choose peace over pressure. When your body feels light, your mind feels calm, and your relationships feel warm, that is your rhythm.